Chief's convenience. If you can't find what you want, let us know and we'll get it.
We're in our third week now of in the state of recovery and following the state of emergency, which we all experienced. Things are going well. Things are on track, moving towards that state of normalcy as defined in the emergency preparedness law. With the cases, in the community, no stabilizing or stabilized, and things reopening, and we're not seeing any major impacts from opening of businesses and having more gatherings and such. So we're almost at that point, where we could relieve most measures, and looking towards April, to go back with official recommendation to council, to end the state of recovery and officially declare that we are in normalcy, or the new normal as people have been calling it, right? Every week, the experts sit together and have some discussions on what's the best way forward, and provide recommendations and support, such as Ganawagi education system decided to keep masks for the next little while, for our children, as a one level of extra safety. They'll be assessing that as we go on. But in terms of public, we don't want to put an exact timeline on it, but certainly we're looking at the minimum amount of time. We want to make sure we're looking at the proper data, seeing the impacts that's happening from other jurisdictions that we've seen in provinces and Ontario, as well as in Manitoba, Saskatchewan, I believe, they removed their mask mandates. What's going to happen there in the next little while? Once a state of normalcy is declared, and then the Ganawagi emergency preparedness law is no longer active, right? It gets shelved to a certain extent. It's there. It's a tool. If we need it, we can reactivate it. But that's a decision of chief and council. But at that point, the pre-pandemic mandates that existed with public safety, Public Safety Division and some Public Safety Commission has mandates for global public health, public security safety. Public health at KMHC has their responsibilities, KSAS has theirs, and as do other organizations. So basically, we revert back to the way we operated, prior to the pandemic. Now, we'll always have a connection, and I need to make sure that we keep those alliances and we keep that working relationship close together. But at that point, we operate very, very similar to the way we did prior to the pandemic.